The Royal Tropical Institute is involved from the start in REACHOUT, and we are mainly involved in the first part of the 5 years, because we are doing the context analysis phase. And that consists of different things. First of all, the international literature review, which we are doing right now. And we are also involved in the 6 context analysis qualitative studies that are going to be conducted in the 6 countries, of which for which we are providing support to the countries. And we have made a generic protocol, and we will do data analysis trainings and so on. I think the strengths are that it is focusing on the close to the community providers, which is a theme that is very important all around the world, and lots of governments are relying on this kind of providers to improve healthcare for people that don't have the access to it. So I think it's a very important subject that we are working on. And yeah, the close to the community providers, they are the first link, they are the link between community and health systems. And yeah, to be able to improve health of people in developing countries, I think it's great to focus on this cadre in the health system. I think the strength of REACHOUT is that we are working together with 8 partners all around the world, and we are really able to learn from each other. We have different strengths and weaknesses, and we can really work together. We all have a different focus, and we have different types of CTC providers that we are going to research, but at the other hand we also have a lot of similarities. And I think it is great to learn from each other and to see where we can have an added value, where we can come to conclusions that haven't been reached yet, because this is one of the very first, I think, big research projects with so many countries in it. So that's the added value, I think, of REACHOUT. Yeah, I think close to the community providers in general, they are having a big workload. So it can be sometimes difficult to do research, because research is like an extra burden on them. So that can be one of the things. Maybe in some of the regions they don't have the precision yet that they have in other countries. It's about recognition, both by the government but also by the community. So we have very different contexts that we are working in. So that can be a challenge, but at the same time it is an interesting thing to work with, and to see what's there in which context and how we can improve something there. I think that's really what I like about doing research on health systems, because I've been at the policy level myself, and I was always looking for evidence-based, data that you can use to make decisions on changes in policy that make sense. You always want to know if you are doing the right thing. So in this case, I think REACHOUT can really contribute a lot to the international policy making, and we are well linked to several international organizations, UN organizations, which currently are really focusing on mainly community health workers. So I think lots of that kind of organizations, but also national governments, they are quite eager to hear more about effectiveness of certain interventions with CTC providers, about costs, about how to scale up. So it is quite obvious that a lot of things we still don't know, and we know that we all use the CTC providers very much. So I think there are great opportunities to share our results, not only at the end but also in the middle of the process.